I'm Dr. Paul Mann. I'm an ophthalmologist here at Mann Eye Institute, and I'm with Dr. David Tremblay, and we are here to answer some questions that are commonly asked about LASIK surgery. So I like to tell my patients that immediately after the procedure, they're going to be seeing better already. However, their vision is going to be kind of hazy, almost as if you're underwater in a swimming pool, and over the next several hours it clears. It just keeps progressing, and over the course of 24 hours, they really have good vision, and typically they're able to drive in for their appointment the next day.
Right, I can tell you after my own LASIK surgery that evening I was able to watch television, work on the computer. It was a little bit hazy, but by the next morning I drove safely into work. I actually worked an entire day at the clinic.
Yeah, people can go back to work the next day. There's no question about it.
Yeah, absolutely. So the point of LASIK surgery is to become independent of glasses and contacts. However, there is a time where all of us become what's called presbyopic, where we start to have difficulty with near vision. And that typically is a process that happens in the mid-40s to late 40s or early 50s. There's a common misconception that that's LASIK wearing off, where in fact it's actually a process that's occurring inside of the eye, where the crystalline lens becomes a little more dysfunctional and harder to focus up close. So yes, there is a point in time where you may need to use some reading glasses for near vision. However, at that time, there may be some possible procedures that can be done in addition to get you out of those glasses as well.
Absolutely. We could go back and do another LASIK procedure to make one eye focused for reading and keep another eye for distance, or there are also some lens-related changes as well.
Absolutely.
I tell all of my patients that the #1 side effect from LASIK is dry eyes. 100% of patients experience dry eyes after LASIK, and the recovery from the dryness typically depends upon your age. People that are in their early 20s can recover within 2 to 3 months. People in their 40s or 50s may take up to 6 months, and they just have to be prepared to use a lot of artificial tears.
Right, and I feel it's also important to tell patients that have some pre-existing dryness, maybe that are already on a prescription eye drop for dryness, that may also be the case after surgery. Now, often what I've found is that patients that have dryness related to contact lenses, since we're getting rid of contacts after surgery, the dryness is actually better afterwards, and there are absolutely studies to show that.
A common misconception about LASIK is that it creates night vision problems, and perhaps back in the mid to late 90s, LASIK did create some night vision problems with patients, but the technology has tremendously improved, and now patients may have temporary halo or glare or starbursting after the procedure, but that's really pretty much gone by the 3-month point in their recovery.
Right. So recovery from LASIK surgery is fairly simple. For a few nights afterwards, you're going to need to wear a hard plastic shield over the eyes to protect yourself at nighttime. Often things can happen that you're not aware of. You could accidentally rub your eye, your spouse could hit you in the eye, you could roll over and hit your bedside table. So to protect from things like that, you're going to need to wear some plastic shields. You don't have to wear them during the daytime. We just ask that you protect the eyes. If you're out and about, wear some sunglasses. If you're working at a computer screen, you don't have to wear anything. But at least for the first few nights afterwards, we want you to wear some hard shields. You're also going to have to use some eye drops. There's an antibiotic and an anti-inflammatory drop for about a week after surgery, and then a lot of frequent artificial tears just to maintain lubrication, make sure we don't have excessive dryness.
I like to stress the artificial tears. I think that what I recommend to my patients is that they use them as needed for a prolonged period of time, and slowly over time they will need them less and less and less, and somewhere between 2 and 6 months after the surgery they get to where they really don't need them anymore. So typically I tell my patients that they're able to drive themselves in the next day as long as they're comfortable with their vision. They're able to go back to work the day after surgery. Typically we do LASIK on Friday. I tell people to pretty much resume normal activities on Monday except for swimming and eye rubbing. So I try to encourage people not to swim or rub their eyes for 2 weeks after the procedure.
So visual recovery from LASIK is usually very fast.
Overnight?
Exactly. So I actually drove myself to work the next day and worked an entire clinic without any issues. There are going to be some nighttime symptoms for the first week or so, some halos and glare. I was still able to safely drive at night, and most of my patients can. There are going to be some patients that were higher treatments, very nearsighted with a lot of astigmatism, that may take a few extra days or a few extra weeks to get to their final destination, but their vision typically is still good enough to perform most tasks.
And with today's technologies, over time, really over the course of the first month, the vision just keeps getting better and better and better up to the first month or so.
Yes. So if you're interested in LASIK surgery and you want to see if you're a good candidate, come in and see us at one of our offices here in Austin or Houston, or go to our website at maneye.com or call us at 1-800-MyVision.
We're looking forward to helping you.